computer. Hi, welcome to everyone in the audience. My name is Dr. Eliana Ramirez. I am the director of the Community Mental Health Equity Project, otherwise known as CMEP TA Center. We are funded through AB 74 specifically to look at the cultural competence plans, which are written on a 3-year basis currently by ethnic services managers, otherwise known as ESMs at the county level, oftentimes in community with community-based organizations, consumers, family advocates, and other stakeholders who have an interest in addressing behavioral health disparities at a local level. So the CMEP TA Center was funded to engage in a really robust community listening process where we can hear from subject matter experts like our colleague Maria Arteaga today, who is an ethnic services manager, as well as 2 additional roles in the County of Santa Barbara, to really hear from their perspectives what is working with the CCP Cultural Competence Plan guidance and what might be changed since it hasn't changed since 2010. We know that in 2022, there's been quite a bit of change among ethnic services managers in the county level. So at any county, you might find an ESM who's been in that role for quite a while, or you might find someone who's fairly new to their role. And so we wanted to chat with Maria to hear what she's learned over the years as she's been doing the CCPs in Santa Barbara. So welcome, Maria. Thank you so much for being here. Would you share a little bit with us about your experience as an ethnic services manager and writing CCPs in Santa Barbara?
Yes, thank you. So I've been writing cultural competency plans for the past, I would say 2017. And during that time, I really took a closer look at the framework of the cultural competency plan requirements, right? And really understanding what that requirement is. And what are those indicators that are listed there that really we needed to pay attention to and really give that story to. And so one of the things that I did very early on is that I went ahead and self-educated myself. I went and looked at different cultural competency plans throughout the county, and then also looked into the informational notices too on those particular requirements, and also consulted with subject matter experts on what does it really mean, right? Because I really wanted to capture the whole story of how do we go about in delivering culturally competent services throughout our system of care. So it was a really deep dive, first of all, in understanding the framework, understanding what we needed to and how to do it in a way that we provide culturally responsive care to those individuals, right? To give the true story, right, of who we're serving and how are we serving, and how do we eliminate those barriers. So that's what I did very early on. There was a lot of reading. It was, I would say, evenings. I did this after the working hours because, I had responsibilities that I had to take care of, but it was in the evenings that I self-educated myself and really looked into secondary sources like like books, that really laid out the foundation of understanding racism, understanding diversity, right? So my profession is not as a social worker. My profession is more of a legal education background. So I had to, really just self-educate myself and really to be able to do a good job and tell the story of how our county was providing culturally responsive care.
It is so incredible to hear you talk about how you engaged in that kind of self-education, and that you did it in the evenings and outside of regular work hours. We have hosted 29 listening sessions to date with ethnic services managers, behavioral health directors of county departments of behavioral health, as well as community-based organizations, consumers, family members, and just a wide group of people who are really committed to addressing behavioral health disparities. And what comes through in many of the ESM meetings, like you've just described, is that a lot of people are kind of figuring it out on their own. And it does require that, going and reading the information notices and reading the examples, whether it's from one's own county or other counties of cultural competence plans. But I know that for many people, this is, it's work that does end up going outside of regular office hours. And so I just want to acknowledge that and thank you for that, because it's not like this is information that's easy on the mind or the spirit or the soul to be reading. If you're reading about behavioral health disparities, you're reading about how some of our communities, based on race, ethnicity, based on sexual orientation or gender identity or language or immigration status, have higher rates of mental health challenges or substance use challenges or physical health challenges that can also come up at the same time. So it's painful stuff to read about.
Yeah.
And if you're doing that in the evenings outside of regular office hours, even more so. I wonder, when you step back and think of Maria back in 2017, when you just started to educate yourself, and thinking about somebody right now who's just entered the role of an ESM, what do you know now that you wish you had known then when you started to write cultural competence plans?
I think one of the things that I would say is have a foundational work, understanding of the equity principles, or the foundation of equity, really understanding what equity is, really understanding what disparity is. Also the prevalence of seriously mentally ill versus people that are not, because those individuals also need the support, emotional support. Also really, I would say, understanding the community needs, and really having that active listening, and not respond, so there was a lot of learnings that happened throughout the way. But I would say for anybody that's starting new, it's like, get yourself, those foundational principles that you need to know to build on the work that you're going to do. Because at the end of the day, I see that there's a vision, and you have to know what your vision is in order to eliminate those disparities. How are you going to go about doing it? And once you have that strong foundation, you can build on those strategies to end those disparities within your county system.
I really appreciate you talked about needing to know the local community. So the cultural competence plan is written at a county level on purpose, recognizing that there are a great diversity of counties across the state of California and great diversity within each county. So starting off by listening and learning who that local community is makes so much sense. And I also really appreciate that you talked about starting off with a foundational level understanding about key concepts like equity, disparities. You talked earlier about racism. So different interpersonal and institutional level decisions and policies and practices that affect different groups of people in different ways. You also talked about understanding, really getting into the criteria of the cultural competence plans. And so for folks who might be new to their job as ESMs, or just new to the conversation of cultural competence plans, the CCP is organized around the National Cultural, Linguistically, and Appropriate Services, so national class standards. And those national class standards have been updated over the years, but that is the organizing principle around which the current criteria of the CCP is mapped on. You talked earlier about hiring and bringing in a subject matter expert to kind of walk you through some of the way to think about your local behavioral health disparities. I wonder if you could tell us a little bit more how you chose that subject matter expert and exactly what kinds of help they provided.
Yeah, so I didn't really hire. It was more of a It was more of a partnership, I would say. We knew each other from various different works, right, from community work. So it was really about calling upon that individual to know about, how do you look at this data, when we're looking at disparities, what would be those variables that we as a county system would benefit to have in our system. So those kind of conversations that I had with the individual, and really, I would say he mentored me, to look at different ways in collecting data and really posing those questions that will get you where, you want to ask. It's like, okay, how do we measure that retention rate, right? And how do we look at different diagnoses and how are each individual is being diagnosed? Is race, age considered into these diagnoses, and how often maybe some people are more diagnosed as depression versus the others, right? So those kind of conversations are the ones that we had, and I really wanted to know more, right? Because I wasn't a researcher and I didn't have that lens. So having someone, researching evaluation component to it was instrumental to this work. You have to have the data in order to make informed decisions.
I so appreciate that you give that really concrete example of diagnosis and having the data, and the difference between the data. Are we looking at a penetration rate, which means are we having the percentage of community that we would expect and walk through the doors in the first place, versus our retention rate? Are some communities dropping out of services more than other communities? And then when you talked about the diagnosis, are we seeing that a diagnosis is being given equally across communities, or is it overrepresented in some communities versus others? And what might be behind that? So are we assuming that, for example, youth of color, youth who are Black, Indigenous, and other people of color, are they ending up with a higher frequency of diagnoses that have to do with conduct disorder, for example, versus depression or anxiety? When we know that the diagnosis of conduct disorder can put people on a fast track into the juvenile justice system versus fast track to get mental health services. So there are diversity, equity, inclusion issues that result in some communities getting some diagnoses more than others, but it also impacts their trajectory into, are they getting help or are they being criminalized? It makes a difference. So you talked about that data piece. We know that that's a challenge for a lot of counties. For a lot of ethnic services managers, they'll talk about, well, I know in my CCP and the cultural competency plan, I need to show what the data says is happening right now in my county and where there are disparities, and then what the plan is to change them. And then in those updates, those annual updates in between the 3-year reports, people then are supposed to reflect back and say, well, did we see any change in those disparities? When people talk about challenges getting data, I feel like this is another place where you were really creative in trying to figure out how to access the data in the first place. Can you tell us a little bit about where you access the data for your CC, please?
Right. So the U.S. Census, that was one. The American Survey, that was another one. The American Community Survey. The other one is, well, EQRO data, that's very important for us. Claim data, who are we serving, the Medi-Cal beneficiaries. And then plus, just to get an idea of how many true Medi-Cal beneficiaries there exist. So in our county, we have SynCal, and they produce data. So they let us know, like, we have so many Medi-Cal beneficiaries by race, ethnicity. So I was able to look at that as well, right? So there's just different data sets that taking a look at them and just exploring it and comparing it to the people that we're serving, right? And that would really help us. Who's coming in? Who do we need to reach out to, and things of that nature.
some counties have ethnic services managers like yourself who are doing several additional jobs. And some have talked about being, in addition to an ESM, ethnic services manager, also being an MHSA coordinator. And the benefit of being also the MHSA coordinator or working closely with the MHSA coordinator is that the MHSA coordinator oftentimes has data that can be useful to the CCP. Did you find in your county, and of course all counties are different, so this would only be relevant to Santa Barbara and perhaps just at a certain moment in time because staffing changes. But were there any staff within Santa Barbara who you specifically found were helpful to get you the data that was unique to your county?
Mhm. So one of the things is really working closely with the quality management team, right? Which is composed of research and evaluation. So our research and evaluation team collects all the data for MHSA, right? So I was able to get that data for MHSA and then break it down even further to, well, not breaking it down, more aggregate data in regards to race, ethnicity, language, who are we serving? So that way I would be able to do the analysis and compare it to our general population, but also our client utilization and see where the trends are, in regards to that. But it's very important to work with quality management staff because they are the holders and also the individuals that really could help with moving quality assurance or quality management forward.
I appreciate that perspective on the quality management and engaging them, especially at the county level. I know many counties, if not the majority of them, I think the last count, it was somewhere over 95% of the counties have a committee that it might be called cultural competence committee. Some counties call them something different, an equity committee, but these are committees with different staff at the county level. And sometimes, as we were saying before, CBOs, local community-based organizations, also sometimes consumers and family advocates or other stakeholders are part of that committee. I wonder if you could talk a little bit about the committee in Santa Barbara, who's on the committee, what they do in terms of helping with the CCP.
So I have the Cultural Competency Diversity Action Team. And then I have a subcommittee called Building Resilient Communities. So in my cultural competency, which is the wider committee, we have different goals for the year, right? So I'll give you some examples of our current goals. It's like language access. We worked on that, not only our policies and procedures, but also we worked on a survey in evaluating the interpretation services, right? We worked on our website, how do we make it more accessible, right? So there's like different goals that we do. And then there was an alcohol and drug, the whole component of making sure that, we're providing culturally responsive care, and we had also a goal on outreach and engagement, right? And what are those strategies and who are we not serving? So these are kind of the dialogues that we had throughout our different meetings throughout the year, and we broke up into groups. Now, one of the accomplishments, other than policies and procedures that we wrote collectively, right, that help inform and our organization, but also that outreach plan. We did an actual outreach plan that would help us, in better outreach, better strategies to serve those underserved communities or marginalized communities and things of that nature. So all this information that we do here goes into our cultural competency plan in planning, in our strategies, right? And there's a part, criterion 7, which is language capacity. And there they're contributing to shifting, I would say our organization to look into more accessibility component and language, right? So those are kind of the ways that I use our cultural competency to inform the organization and switch, I would say, modalities of operations or improved modalities of operation. And then in my Building Resilient Communities, we're currently working on a outreach engagement tool, right? It's like, okay, we do a lot of outreach, but how are we really measuring the impact of that outreach, right? We're doing a psychoeducation class, but how are we measuring that? So we developed this measuring tool that that let us know about those that self-seeking behavior, the stigma that's attached to mental illness. Did it decrease after this psychoeducation, right? And people are aware of mental health resources out there in the community. So we're working on two tools, one for specifically for health fair events, and the other one for those conference or psychoeducation that the individuals receive to measure, the impact of that engagement.
If no one said so before, I hope it's okay for me. Santa Barbara's really lucky to have you. Oh my goodness. and you're really lucky also, it sounds like, to have the people who are on these two committees, because you're doing really concrete, meaningful things. I wonder if you could talk a little bit about there's so many things that you could be working on. How did you decide on those specific things to work on?
Okay. So one of the reasons we worked on these is because in 2019, we did an organizational needs assessment. And part of the recommendations and the findings was that it was the building of language access, right? The other recommendation is our cultural competency trainings. So in the past, cultural competency trainings were based on a learning platform. Well, now I brought in cultural competency trainings, live individuals that are able to present the information. So what was the other thing? And then outreach and engagements as well, right? So these recommendations came based on this cultural organizational needs assessment. Yes.
I'm appreciating that it sounds like you are constantly in a state of self-reflection and evolution. That at one point you said you had cultural competency training that was on an LMS, that was on a learning management platform. And at a certain point in 2019, you did an assessment and thought, okay, actually, it would be more impactful to have a live human being doing these trainings than having people do it over their computer. And that really resonates with the national class standards, this idea that it's normal, it's actually beneficial, and we should celebrate when we do regular iterations of self-reflection and know that we are supposed to find areas to improve. That's the whole point. But some of us sometimes can feel a little bit shy or like, oh, I did something wrong. And it's like, no. Diversity, equity, and inclusion work is all about realizing that there's always room for improvement, and that when we identify those spaces of improvement, that we need to have the courage and the boldness to honestly assess what is working and what isn't working, and let go of the things that aren't working and try out something new. As a leader, that can be an interesting thing to do with your committee members. I wonder if you could talk a little bit about how have you brought the right people into these committees, and how have you kept them engaged in the work so that you'd have such great outcomes?
I think that I'm very fortunate and very grateful to them, because they are very passionate and they're great leaders in serving the community. And for the longest time, they have wanted to see some change. And when we work together on these goals collectively. What is important to them as well? And what do they want to see? And I think that that's the part that has that cohesiveness in building, because I keep saying we're building together. And this is part of us. It's not about behavioral wellness. It is about us, because at the end of the day, we're all committed to serving the community the best way as possible. And I think that that's the strength, I believe.
One of the reasons why I'm so grateful for you to take time to speak to the audience in this Cafecito recording, but also the many conversations that you have had with me and giving feedback about the CMEP TA Center project, where we're going, how things are have worked so far. It's because you, I think, tell it like it is. You speak directly to things, but also I think that you see things in a time sequence, and you're contextualizing what's happening now and what has happened in the past and what could happen in the future, and bringing to this work both a real sense of hope and optimism, but also unwavering commitment that we have to address the issues that are keeping some of our community, some of our family experiencing greater mental health, substance use challenges. That ultimately we should be focused on the community, and that the relationship between the community-based organizations, between the consumers and family advocates and the county behavioral health department is everything. And so when you talked about that, we're doing this together, we're doing this about us. This is not about behavioral health or anything else. This is about us coming together. It's just such a important way to make sure that if we're inviting people into a committee, they have real opportunity to make actual change with their voices. They're not just rubber stamping something. They have an opportunity to help us to plan out the thing rather than sign off on after the plan or the activity has been done. That takes some guts, frankly. It takes some risk, right? Some ability to tolerate risk, because sometimes you're going to hear things that are not always pleasant or positive. What recommendations would you have for ethnic services managers who are new to this role of creating relationships with the community in service of addressing the local behavioral health disparities? What helps you to do this so effectively?
I think being your authentic self and also transparency, you know, and I would say, you know, both individuals or both groups or all the groups getting together and just visualizing what that goal is. What do we really want to accomplish? I would say you have to have that. And most importantly, you have to build trust in the beginning. That is the number one factor that will make a committee work is the trust. And you only do that by being your authentic self and being transparent as possible with the information, right? And I think people would be grateful for that information, you know.
So my next question, which is a completely unfair question, and I don't expected that you would have an answer to this, but it's kind of essentially, how do we clone you? So considering that we can't actually clone you, I just wonder, what advice might you have to newer ESMs also in making change at the systems level in the county? You just talked about some key ingredients for those relationships with the community. But we also know that ultimately the cultural competence plan is to make change within the county Department of Behavioral Health. So I wonder if you could talk a little bit about that.
Yeah, well, I think the key ingredient, again, I think is that trust. You have to build your relationship within as well, right? And be as much as supportive and informative, and really telling I would say your colleagues why we're doing what we're doing, right? And it's not about you. It is about, at the end of the day, better service to the community. And if we say why we're doing what we're doing, you're building that trust and you're building that camaraderie to move forward as a team. We always have to say we're in it together as a team and we're building together as a team. And this is going to benefit our community. And it's very important to build strong relationships, not only out externally, but inside your organization, to really work with your quality management, your supervisors, your director, giving as much information. People that need this information from you, they should also know this information so they can help you, in moving things forward.
It's incredible when I think about you started doing the CCPs in 2017, you had this really unique perspective of having read several CCPs and then being able to work with a subject matter expert. And I've seen how those years of experience and the relationship building that you just described with the community and in your county are making for really meaningful outcomes. I really appreciate you taking the time to share this with us. And I would just invite you, as we kind of wrap up here, if there's anything else, any other advice that you'd like to share with ethnic services managers or anyone else who's addressing behavioral health disparities.
I would just like to share that we need to stay up with the times, the trends that are happening, and acknowledging them. Any moment, any opportunity that we have, acknowledging what's happening out there, that and to build that cohesiveness, and that we could work together to resolve the issues, I would say.
That's such an important piece to land on. I find that in 2022, many of our departments are understaffed. Many of our staff who are still here are working with a community who is being pinched, whether it's the pandemic or wildfires or the recession. Our communities that we're serving are really oftentimes suffering under the weight of everything that's happening right now, the systemic racism in the community. And I just really want to take a moment to give a heartfelt thank you to you and to all the ethnic services managers who continue to toil away at this work, because you all have not chosen an easy job, but especially not in 2022. But everything that you're putting into this work, my goodness, it makes a difference. And especially for those of the community who are most oftentimes falling through the cracks. What you're doing is helping to identify those cracks and to fill them so that all of our community members can have the greatest access to health and wellness. So thank you so much, Maria. If people would like to learn more, we would invite them to go to the CMEP TA Center website. And I'm so excited to learn more about your work in Santa Barbara. Thank you so much, Maria.
Thank you. Thank you so much.